Hello, everyone, and welcome to the Fairfax Cryobank webinar this afternoon. We're going to get started in about another minute just to give everybody some time to log in and get ready. Today's topic is LGBTQ family building using donor sperm, and we are very excited to present this information to you and answer your questions today. So we'll get started in another minute. Good, we're getting lots of people joining. All right, so we're going to get started. Again, to everybody who has signed on, welcome. We're going to have people joining as we go through. This webinar is being recorded, and a copy will be sent to all of you who registered for the webinar today. If you have questions as we're going through, please submit them in the little question section, and we will do our best to cover all of the questions during the Q&A at the end of the webinar today. So again, welcome to the Fairfax Cryobank webinar. The topic today is LGBTQ family building with donor sperm. And if you've been to our webinars before, you know I always like to start with an agenda. So you're going to be hearing from me. I am Michelle Adi. I'm the Lab Director and Director of Operations for Fairfax Cryobank, and I am going to be talking to you about donor sperm, the screening process, and your options in what to purchase. And then once we get to the point of purchase, I'm going to pass it to Kate Wisda, our wonderful nurse practitioner in our Pasadena lab and in our Pasadena clinic. She is going to talk to you about insemination options. When she finishes, she is going to pass it over to our wonderful guest today, Jenna Jaffe, who created and is the founder of Connecting Rainbows. She has a Fairfax family herself and is a lawyer, so she's going to be talking about some of the legal perspectives around building queer families. And then, as we have had in the past for the Q&A, we have Doreen Duggan, our client services supervisor, joining us to answer all of the questions. So you've got everybody on. I'm going to start, and they are going to pop off their cameras, and then they'll join us as we go through each of the sections. Okay, so just to get started, before I dive in, I just want to acknowledge and make sure we're all on the same page. We need three things to make a baby. You need eggs, you need sperm, and you need a uterus. And those eggs and the sperm can come from either yourself, a partner, or a donor. And then the uterus can either be yourself, your partner, or a surrogate or gestational carrier. And so you just need those three things. And when building queer families, we can use a different combination of those for each of our unique families. So we have options in donor egg, options for donor sperm. You can use a known or a directed egg or sperm donor. That process is different than using a donor from a cryobank. Similarly safe in terms of testing and medical information, but some additional consents and things are needed in those processes. And then, of course, if trans individuals are banking their eggs or sperm prior to transitioning in a fertility preservation move, they have those samples to use with either a sexually intimate partner that will be the recipient of those gametes, or with a gestational carrier surrogate. Of course, surrogacy and gestational carriers are options for us. And then, of course, adoption as well. So today we're going to be talking specifically about the journey of building a family using donor sperm. And I'm going to start by talking to you, as I said, about donor screening, and then just some tips on how to choose a donor if you haven't gotten that far yet in your process. So I will start by saying that it is not easy to be a sperm donor with Fairfax Cryobank, and I think that's a good thing. It makes our jobs a little harder, but it makes the final donor pool that's available to you higher quality and better. So approximately 1 out of every 200 initial applicants makes it through this whole screening process to become a donor with the program. We require them to provide 3 to 4 generations of medical history, self-reported, reviewed multiple times and verified with them through interviews with the staff. They will then come in to produce semen samples on site at our clinic, and we will do what we call donor screening, where we're doing semen evaluation to look at all of the fresh parameters of their sample, ensure that it's good quality, and then we will freeze and thaw the samples to test them to make sure that they can survive that freeze thaw process, because as you can imagine, that's really rough. That's not easy on the cells. If everything looks good and their samples are high enough quality, which as an aside, we're looking for individuals with specimen quality that's actually higher than what the World Health Organization standard is for what they consider a healthy, normal semen sample, because as I mentioned, that freeze thaw process is rough on the cells, and we need a really good sample to start so that we can get them through that freeze thaw and have enough cells there for you. If everything does look good, they then have a physical examination with a medical health provider that we're contracted with, or someone on a physician on our staff. And they will have infectious disease testing initially and then periodically as they're in the program. We do robust genetic disease screening, which I'll give you a little bit more detail about the infectious and genetic screening. The donors are completing eligibility questionnaires at every single visit. And once they make it into the program, they're with us for at least 6 months, once a week, so that we can get enough samples to provide enough samples to you all to meet the family, to either be below or at family limits. So they're completing those eligibility questionnaires about their health and their lifestyle at every single visit. Before they're even in the program, we do a criminal background check. They have a psychological screen, which is called the PAI, or Personality Assessment Index. And that is a tool used by mental health providers to assess individuals for psychopathologies. So diagnosable mental health issues such as bipolar, clinical depression, schizophrenia, things like that. We do a double verification using a photo ID, and we have a system that is a biometric thumbprint verification at each visit. And we do verification of their educational criteria. So if they say that they're in medical school, we get copies of their undergrad transcripts as well as their current transcripts or diploma, for any level of education. And then, as I mentioned, the applicants are having multiple interviews and interactions with trained staff members. So all of that is that it's sort of, think of it as a funnel where the 200 guys start at the top and they're going through the process, and only 1 or 2 maybe come out at the bottom to make it in through all of that screening and get into the program. So it's not easy. You'll see things quoted from other banks and in the media of, it's easier to get into an Ivy League school than it is to be a sperm donor. Statistically, that may be true. I don't think it's the same thing, but you'll see that. So just to give you a little bit more information about the infectious disease testing, we do all of the serological testing and nucleic acid testing that the FDA requires, and then some. So we are an FDA licensed cryobank, and you should really only be using an FDA licensed cryobank. The major cryobanks are licensed, and you want to make sure that's the case. They require, when I say serological testing, it's blood testing, either on blood or serum, and we're looking for things like HIV, hepatitis B, hepatitis C, cytomegalovirus, or CMV, syphilis, and HTLV 1 and 2. And then we also have to do some, I said nucleic acid testing. What that is, the process is through polymerase chain reaction, PCR. And through that, we're also looking for HIV, HTLV, HCV. We're also doing chlamydia and gonorrhea, the CMV, which we actually are not only doing CMV on serology, we do CMV NAT testing. So actual semen sample, DNA is extracted, and the PCR is done to see if there is any CMV virus in the actual semen. And then we also do herpes simplex virus 1 and 2, and we're actually the only cryobank who tests for human papillomavirus, or HPV. There are 2 strains of HPV that are known causative agents in cervical cancers for women. It's HPV 16 and 18, and we actually do the PCR testing for both of those strains on the semen to ensure that it's not there. And then if there's any other indication that there could be an issue, we'll do additional testing. That's the infectious. Now, genetic testing, as you can imagine, genetic testing and screening has changed leaps and bounds since the cryobank was first founded 35 years ago. The technology has improved massively, and it's actually changing every day. This is sort of a moving target, but all of our donors are going to have a chromosome analysis. And what that is, it's called a karyotype. Chromosomes are extracted from the white blood cells in a blood sample, and they are visualized sort of for their morphology. They're visualized to ensure that the chromosomes are intact and there are no significant translocations that would cause any issues or deletions or anything like that. So that's done on all of the donors. They all have cystic fibrosis testing. We're doing hemoglobin electrophoresis on blood samples from all the donors. That specifically is looking at things like beta thalassemia, alpha thalassemia, sickle cell disease. We're also doing spinal muscular atrophy. And then it's important to note, as I said, because this is a moving target, each of the donors, when you go to their donor profile, is going to have a genetic testing summary, and that's going to specify everything that they've been tested for. Since January 1st of 2018, we've been working with a lab to do expanded carrier screening for over 280 recessive diseases. And what this means for you is that some of the donors are screened for this expanded carrier panel, and they're non-carriers, meaning there's no indication that they are carriers for any of these recessive conditions. Others are carriers. Now, for a recessive disease, you have to have 2 copies of the same mutation to have an affected child. So as long as you're not a carrier, it's okay that the donor is. Same goes for the reverse. If you know that you're a carrier for disease ABC, you can search on our donor search for a donor that has tested negative for carrier status of that same disorder. If you are specifically interested in the expanded carrier panel and getting some more information about how best to choose a donor that's suited for you, there is a wonderful webinar that we recorded with our genetic counselor a couple of months ago. You can find it under resources in the blog on our website. And she talks all about expanded carrier screening, as well as the best way for you to do the search and look for the information that you need for the donors. So because that is different for each donor, I would say check out the genetic testing summary on their profiles. So now that I've given you the background information, just a quick couple of tips on how to choose a sperm donor. If you haven't started yet, I always recommend that the best place to get started is by creating a list of characteristics that you value. Anything from physical features, height, hair color, skin tone, eye color, shape of the eyes, or other things like that. Ethnic origins, if your ethnic heritage is something that you really value and you'd like to share that with your child, you can look for donors with specific ethnic origins similar to yourself and or your partner. Education may be something that you highly value, so you want to look for like a grad level donor, something like that. ID versus non-ID, all of those different things. So create that list and start there. And I will recommend, and I think CS Doreen would agree with me on this, and she can correct me if I'm wrong in the Q&A section, but I think it's better to start with fewer limiting criteria. That way you have a bigger pool to start with, and then you can start whittling down by adding additional things that you want to sort of rule out or rule in. And the best way really to get started is to just jump right into the donor search and start putting in some of those selection criteria. And what you're going to see is there's a lot of information on the website, and some of it is free. Things like the summary profile, the medical profile, staff impression, donor essay, short clips of the donor, clips of the staff talking about the donor. All that information is free. You can get the medical profile for every single donor on our site. If you want to start using some of the other products, you can either choose them a la carte and just sort of purchase as you go along, or I wanted to put this in here because this is a much more affordable way to do it. We offer unlimited access packages that are for 90 days, and we have 3 different levels: basic, full, and full with what we call Club Fairfax. You can see on the infographic all of the different things that are added, and I'll just put in a little plug for the full access with Club Fairfax. It actually ends up paying for itself. As Kate will tell you when she goes through the insemination process, each person, under 35 that has no fertility issues has about a 15% chance of achieving pregnancy each cycle. So it's not common to get pregnant on your first try. So keeping that in mind, we've offered this Club Fairfax where there are some bonuses that you get in there, where 2 free shipping to your clinic or your home, that there covers the cost of the membership. But then you also get a 6th vial free when you purchase 5 within 1 year. And you also get a preview of new donors added to the web. And I will say that is really beneficial because once they go up, our new guys tend to sell out because the first time they go up, they only release a small number of vials. Anyhow, this is a cost-effective way to be able to access all of this information on all of the donors for a 90-day period. And most people will be able to select their donor using these products. I will tell you that in my experience, along with childhood photos, the audio interview tends to be one of the best tools for people to help them choose a donor. So you have the childhood photo, the summary profile is really important. That just gives you a summary of all of the information. But if there's anything updated, that will be in the summary profile. So for example, when the donors give us the medical history, that's a snapshot in time. That's their history today. That's their family's medical history today. And obviously over time, that's going to change. We all age, we develop health concerns, health issues, and everybody has to die at some point. So all of those causes of death will be updated over time. So the donors can update when we reach out to them annually, or our system allows them to log in at any time and submit an update. We've had guys that will submit, I graduated from my PhD program, or we had a child, or a grandparent passed away, or a parent passed away of such and such a disease, or heart attack, and here's what the treatment was. So that information is all available for you in the summary profile. Face Match is a great tool as well. That is on our website. That allows you to upload a photograph, and it will give you a list of donors with high, medium, and low resemblance matches. There's so many great tools on the website that you can use to choose your donor. And like I said, people really like the audio interviews. They tend to be a really great way to get a sense of the donor's personality. And you get to hear them talking. It's their voice, it's their cadence. You get to know somebody a little bit better that way. So that's just a little tip for you. Once you have a donor, the next step is to know what vial preparation you need. So this, I actually pulled clips from an infographic that's available on our website for vial preparation types. I like this tool because you can either start with the procedure you're going to have or with the vials that you purchase. The first thing I will say is what I believe CS always recommends, which is your medical health provider will make a recommendation to you as to what to purchase. If you are having an in-office intrauterine or IUI insemination, your best bet is to purchase an IUI vial, which is pre-washed. In an intrauterine insemination, Kate will go into the details. The sperm is placed directly in the uterus. And because of that, all of the seminal fluid has to be washed away because there are proteins and hormones in the seminal fluid that can't get into the uterus. They can cause adverse reactions, cramping, and things like that. If your clinic has the ability to wash a vial for you, you can always purchase an ICI vial. And then a good rule of thumb is that 2 ART vials are the same as 1 standard vial. We created the ART, or assisted reproductive technology preparation types, to provide a more cost-effective option for those who have to go through IVF or ICSI, IVF being in vitro fertilization, ICSI being intracytoplasmic sperm injection. You need far fewer sperm to achieve pregnancy using those technologies. And so the ART preps have about half the number of total motile sperm, which is why we say to double if you're going to use them for a standard insemination. So again, for an in-office IUI, you want to purchase an IUI vial. You can use an ICI if your clinic can wash it. In a home insemination, you're doing what's called an ICI, or intracervical insemination, where the sample is going to be placed directly on the cervix, and the sperm will swim through the cervix to enter the uterus. So the ICI are not pre-washed. The seminal fluid is not removed there. So it's a little less expensive because we're doing less to the sample. So your first choice would be an ICI. You can absolutely use an IUI for an ICI insemination, and again, 2 of the ART procedures. So if anybody has specific questions about the prep types, we can do that during the Q&A. But this infographic is really helpful, and it's available on our website. And then, of course, once you know your donor number, your prep type, the number of vials you want to purchase, you can either go right ahead and do your purchase online, or you're able to work with one of our CSRs, and you are ready to start your insemination process. So at this point, I'm going to change presenters over to Kate, and Kate's going to turn her camera on, and she is going to talk you through the insemination processes.
Hello, everyone. My name is Kate Wisda, and I am a women's health nurse practitioner. I work here at PRS, Pacific Reproductive Services. We work with GIVF. So we're going to go through insemination options. We're going to start with preconception health, home insems or ICI, and we're also going to go on to in-office inseminations, meaning IUI or intrauterine insemination. So do I need to work with a medical provider? Short answer is yes. So we're going to ask you to meet with your medical provider to do a preconception visit. We want you to meet with your physician or your gynecologist and tell them that you want to get pregnant. Say, doc, I want to get pregnant. What can I do to have the healthiest pregnancy possible? You can also, if you have a specialist such as an endocrinologist or a psychiatrist, especially if they're giving you medications or they're monitoring your thyroid, it's important to talk to them about the medications that you're taking and should you continue taking them while you're pregnant. We'll talk about that a little bit later on. They're going to assess your health and lifestyle and then make recommendations to prime your body for pregnancy. They may recommend fertility testing depending on your age and medical history. I would recommend for anyone over the age of 35 that you get your fertility tested. And it's best to ensure your readiness for pregnancy before investing in the home insem process. Okay, our preconception exam checklist. So preconception, pre-pregnancy, what can you expect from that exam? So you'll see your primary care provider or you can see your gynecologist. They're probably going to draw some labs on you. We'll talk about that. They'll do some screenings and checks. They'll also do medications and vitamins. They want to know what medications you're taking, whether or not they want to change them, and what vitamins or supplements you're taking. And if you've had past pregnancies, we'll talk about that and ways to have a healthy pregnancy this time. So your preconception exam consists of labs. So pretty standard. They're going to do some infectious disease testing, HIV, chlamydia, syphilis, Hep B, Hep C. And then it's a good idea to know your blood type. So when it comes to blood type, you can be A, B, AB, O, and you can have positive or negative. We care a little bit less about the A and the B, the letters, but we do care about the positive or negative factor, also known as RH factor or rhesus factor. It gets a little complicated when you get into blood type. We want to prevent any incompatibility with your donor. I will say that it is most important for those who are negative, who are planning on getting pregnant. If you are AB, or O negative, and you've had previous pregnancies, it's important to talk to your doctor about blood type. If you've never been pregnant and you plan to have future pregnancies, it's important to talk to your doctor about blood type. We also have a really fantastic blog on our Fairfax website. The blog, if you go onto resources and then go under blog on our main page, you'll be able to go to our search engine and just type in RH factor. And there's multiple articles that explain what RH factor is and why you should be concerned, why you should not be concerned. So talk to your doctor about that. They can also help you make decisions for blood type and potentially even picking a donor that's right for you. Fertility. So everyone over the age of 35, I highly recommend checking your thyroid. If your thyroid is off, then your fertility may be off. So if it's a little high or a little low, you want to get that into a normal range, and that will help you get pregnant in the long run. Anti-Müllerian hormone. Over the age of 35, it's good to check your fertility. So anti-Müllerian hormone checks your fertility level or your egg reserve. When you're born with all the eggs you're ever going to have, and they sit in your ovaries. Each month, a few will develop, one will ovulate, and then you are left to do that again each month. So by the time you hit 40, you may have less eggs. We want to know if it's a small amount or a medium amount or a large amount. That's going to affect whether or not you can get pregnant, and it may affect whether or not your baby is born with a disability or if there's risk of disability. So it's important to know your fertility. You'll know whether or not you'll need to do ICI, intracervical insemination, or IUI, intrauterine insemination, or if you need to go straight to IVF. So it's helpful to do that. If your doctor if you go to your doctor and ask for a fertility test, they may check your estrogen, your other hormone levels, but I would ask for it by name. AMH, or anti-Müllerian hormone. Your gynecologist will know what it is. Sometimes your primary cares have to look it up. And then next we have immunity and vaccines. So rubella and varicella. Varicella is chickenpox. If you are not immune to rubella or varicella, you may have some risk factors such as pregnancy loss or a baby born with a disability if you are to acquire one of these diseases while you are pregnant. So it's important to be immune to them. Your doctor can test to see if you're immune, and then if you're not, they can give you a vaccine, or for varicella, I believe it's 2 shots. Then you wait about a month before you try to conceive, and you should be safe. Influenza vaccine, always get your flu vaccine, and then COVID vaccine is definitely recommended. The benefits are currently, we believe the benefits are outweighing any risk. Preconception exam, screenings and checks. So what do I mean by screenings and checks? So if your doctor told you that you need to get a pap smear every 3 years or every 5 years, it's fine to stick to that schedule. You don't need to get a pap specially for trying to conceive, but if you're due, make sure you get that done. And then mammogram, if you're 40 or older, it's important to get your mammogram. So we know that a lot of breast cancers are fed by estrogen. When you get pregnant, your estrogen gets very, very high and can cause growth of those benign lesions. So it's important, if you have a lump or a bump, to get that mammogram that you've been thinking about getting. It's a good preparation. Check pre-existing conditions. So if you have any fibroids, it's good to know if they grew or if they disappeared. You want to know what's happening in the uterus. Is there any complications related to growth? That may happen in the future if you are to get pregnant. Pre-existing conditions such as diabetes, hypothyroid, hypertension, obesity. It's unlikely that your doctor is going to say you shouldn't get pregnant because you have diabetes, because you have hypothyroid. What they're going to do is they're going to make a plan with you. They're going to say, okay, your sugars are a little high right now. Let's give you a better goal. And we want to get to that goal. When you're at that goal, then we'll know that it's a healthy place to get pregnant. So it's all about preventing any disability, preventing loss of pregnancy. It's about making a plan to have the healthiest pregnancy that you possibly can. A hysterosalpingogram is called HSG. That checks for the patency of the fallopian tubes. Most places that do IVF will require that you do an HSG. For ICI, you don't need one, and for IUI, it's usually dependent on your provider if they want you to do one. Genetic disease. We are in a lucky position in that we already test our donors for many genetic disorders. So I would recommend finding a donor that has a genetic disease panel that's similar to yours, meaning that if you have sickle cell, that your donor tests negative for sickle cell. So it's an opportunity to have a healthy baby when you do IUI, ICI, in a way that you wouldn't with, say, a married partner, heterosex. So it's kind of neat to check out genetic disease. If you're at risk for a particular genetic disease, your doctor will talk to you about that, and then they will recommend testing. Preconception exam, medications, and vitamins. I highly recommend bringing a list with you. Write down all the medications you're taking, the dosage, and when you're taking them. Same with vitamins. I would recommend writing down all the vitamins that you take and showing it to your doctor. They'll let you know what you don't have to take, what you should take, what you add, what you subtract. Medications. Some medications can be harmful to your fetus, we know that. Birth defects, pregnancy loss, prematurity, and other developmental disabilities can be a cause of taking medications that are contraindicated in pregnancy. It's important to know that few medications have been tested for safety in pregnancy or breastfeeding. Vitamins. We recommend that you start taking your prenatal vitamin a minimum of 3 months before trying to conceive. If you're looking for a good prenatal vitamin, make sure you get one that has an added ingredient called DHA. That will help protect the brain and the spinal cord as it's developing. If you're taking any extra vitamins or supplements, please, 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 again, tell your doctor. There are some herbs that are known to help with fertility, but they can be contraindicated with certain fertility meds, such as Vitex or chasteberry and maca root. So make sure you talk to your doctor about whether that is okay for you to take or if it's going to interact with your medications. Next, we have past pregnancies. So if you had pregnancies before, some pregnancies have a higher risk of repeating pregnancy problems. So preterm birth, high blood pressure, preeclampsia, and gestational diabetes. So if you've had gestational diabetes before, we know there's a good chance that you may have gestational diabetes in your second or third pregnancy. It's not a reason to not get pregnant, but it's a reason to make a plan. And that's why you're doing your preconception exam. You're going to talk to your doctor about a problem you had in your first pregnancy and how to prevent it or how to catch it early in your second pregnancy. That will help you have the healthiest baby possible. Reduce risk with proper care before, during, and after your pregnancy. Ask your provider how, and they'll create a treatment plan for you. Is home insemination right for you? Yes, if you are free of fertility issues, you're comfortable with the idea of performing the procedure in home, and we'll talk about the procedure. It's really rather simple. You've discussed family building with a medical provider, such as your pre-pregnancy exam, and if it's acceptable under the laws of your state. Client services can assist with that. Our client services number is listed here. Why try at home? Often couples are told to try at home for several months before when they want to start a family. Home insemination allows individuals and couples without a sperm providing partner to try at home before moving to in-office procedures. So it's a little easier to try at home than it is in the office, and it's a little bit more affordable. It's also nice to do it in your home. Getting started. The person being inseminated must track their menstrual cycle and ovulation. Commercially available ovulation kits help to determine your fertility window. So we call these OPKs, or ovulation predictor kits. I have a sample here. Looks just like a pregnancy test. Actually, the woman in this picture is holding the same one. You would just pee on the stick and you look for a second line. I would recommend getting the one with the lines rather than the happy face that we have provided here. The digital ones can be less precise, but the ones with the 2 lines will let you know 24 hours before you're going to ovulate. We call that an LH surge. There's a hormone in the body called luteinizing hormone. Luteinizing hormone will surge 24 hours before you ovulate. When you ovulate is the only time that you're fertile, and that lasts about 12 to 24 hours. We want to get that timing right, and these ovulation predictor kits can help. All right, we talked about this. You're most fertile for a 12 to 24-hour window, typically between days 11 to 17 of the menstrual cycle. So we have, a lot of us have these apps that tell us when we're fertile, and they'll give you this pink window. So in actuality, you're not fertile on cycle day 11, 12, or 13. Maybe you are only fertile on cycle day 14. Each person has their own different day. Some women have patterns, they're always on cycle day 14. Sometimes they might switch around a few days. So each month could be different for you. And that's where the ovulation predictor kits come into play. They can help you find out that exact day by telling you when you get your LH surge. All right, what do I need to do for home insemination? You'll have a comfortable space where you feel safe, whether that's a sofa or a bed, a needleless syringe. We will provide one for you, and I'll go into that in a second. The sperm sample, which we can ship to you. There's instructions included in that tank that we'll send you, some insulated gloves and some eye protection. So prepare the space and yourself. So I like to say with this bed here, there's way too many pillows for my comfort. But if you love your pillows, if you love your bedroom, you're going to put on your prettiest duvet cover. Find a space that feels really comfortable for you and for your partner if you have a partner doing this with you. Ideally, you'll be reclining on your back with your pelvis tilted for about 2 hours. If candles make you comfortable, soothing music makes you comfortable, get something that'll help you relax for those 2 hours. Place yourself in a positive frame of mind, focus on relaxation, and even meditate if that appeals to you. Make sure you breathe mindfully. So what you're going to do, and this is a nursing trick, you gather everything you need and you put it in front of you. So you're going to grab what we talked about with the gloves, with the tank, all of that. You're going to have that in front of you before you get started. So there's no running around looking for things. Gather everything you need and place on a solid surface. Open the needleless syringe, leaving it in the wrapper. So this is how your syringe is going to come. It's in a sterile wrapper. When you peel it open, you'll have your syringe right here. And it looks just like it's just a regular syringe. Normally there'd be a needle on the end, but for this you don't need a needle. And the tip is dull. Once you open that, you'll place it back in the sterile container and set it aside. The sperm vial thawed per instructions from the cryobank. Remove the tank lid. You will see a puff of vapor. Be careful of that puff. Don't put your face right in front of it. And then wearing gloves, carefully remove the cane holding the vial. So as you can see in the picture and here, this is the cane that holds the vial. Remove the vial, it just pops right off, and verify the donor number. So my vial says 1234. Your donor will also have a similar number. Remove the vial from the cane, verify the donor number, wrap the vial in a cloth or paper towel to dry off the condensation. Put it on your counter, leave it there for 15-20 minutes. It will thaw on its own. Now, if you want to check to see if it's thawed after 15 minutes, just invert it. You'll be able to tell that way if it's still frozen. As long as it moves and looks like it's liquid rather than a frozen solid, you're good to go. The person doing the insemination, yourself or your partner, will wash their hands thoroughly. The person being inseminated will lay on their back with their hips elevated. So I would just put a pillow under your buttocks. You want to make sure that your buttocks, that your pelvis is tilted upward. That'll help the sperm stay in. Pick up and gently mix the sperm vial. We talked about that. You're going to invert it. No shaking, just inverting. You'll take the syringe out. And another nursing trick, kind of fiddle with the plunger. Sometimes they get stuck. So kind of play with it. So see how it moves very easily? The first time you use it, sometimes they get stuck. So just kind of wiggle that around. Grab your vial, which is thawed. You'll take off the top, insert, and just draw it up. If you have a little bit of air in there, this is not like doing an injection. You can have air in there. It's absolutely fine. If you want to get it out, you turn it upright and just kind of push the air out. You're absolutely fine having air in the vagina. It will just find its way out. Okay, we talked about this, drawing up the sample. Place the syringe into the vagina as far as it will go. So here we have a great diagram. This will absolutely fit in the vagina. You do not need lubricant to put this in the vagina. It is absolutely fine as it is, and it will go in rather smoothly. Once you go in, you're going to push it as far back as it will go, and hopefully it will go somewhere around here. So this is your cervix. This is the entrance into the uterus. This right here is your uterus. So we want that sperm to swim in here and then go up to the fallopian tube. The egg will be waiting for it somewhere around here where this little line is. Once you put it all the way in, you're just going to press down on the plunger and the sperm will come out. It's important to let you know that your sperm sample will be very, very tiny. It is concentrated, so don't be alarmed if it's about half the size of this. That is to be expected. It is concentrated and will do the job. Studies show that you do not need a large amount, okay? Let's see. Gently expel the sperm sample onto the cervix, remove the syringe and relax. So you just get to lay there for a while. After about 30 minutes, it's good to turn over. When you turn over, that sperm will wash over the cervix again. So this is the buttocks and this is the belly. So if you're laying on your back, the sperm will start to kind of gather here in the posterior fornix. When you flip over, it washes over the cervix again. So it gives the sperm another opportunity to get into that cervix and get into the uterus. So every 30 minutes, you'll just change position. Also, it's uncomfortable to lay in the same place for 2 hours straight. I would recommend not getting up. I wouldn't do too much of any activity. You do not want the sperm to fall out. It will actually, with gravity, it will fall out. Post ICI, some individuals will use a soft cup placed on the cervix after the sperm is expelled. You can just Google soft cup or go on Amazon. They sell soft cups, not too pricey. They're not necessary, but some find it helpful. You can see right here that if the sperm is gathered around the cervix, that will help keep it at the cervix. Sort of like how I recommended to have it wash over the cervix. It will stay at this area if you have a cup there. Remaining reclined allows the sperm to swim through. We already talked about that. Some individuals choose to do multiple inseminations during the fertile window in one cycle. Speak to your medical provider about this option if you have questions. Yeah, that's entirely up to you and your medical provider. So the cost of a home ICI, the cost of the donor sperm, shipping and handling, we will ship to your home or to your clinic. Fairfax Cryobank will provide written instructions for thawing the sperm, which is just leaving it on the counter for 15 to 20 minutes. And for the ICI with a needleless syringe, right here, okay? Success rates, if you have no fertility issues or concerns, it's about 5 or 10% success rate. You can do several insemination attempts. If you're not pregnant after several home insems, we recommend that you talk to your medical provider, maybe get your fertility tested. Intrauterine insemination. So IUI or intrauterine insemination will bypass the vaginal canal. We talked about injecting the sperm and it just stays here in the vaginal canal and it swims up into the uterus. And IUI will actually be there will be this straw that goes through the cervix for you, for the sperm, and it will deposit the sperm here in the uterus. Same idea with the needleless syringe, but there's a straw on the end. If you're not comfortable, why try IUI? If you're not comfortable with the IUCI procedure, there's also higher success rates. We know that it's something closer to 15–20% each time you try. If ovulation predictor kits don't work for you, guys, these don't work for everybody. I'd say they work probably for 50% of my clinic patients. So if you're trying these and you just never get a dark line, then that's fine. There's plenty of other ways to get pregnant, but I would talk to your medical provider, and IUI may be an option for you. You will also have medical oversight, especially if you've had any previous problems, such as thyroid issues, early miscarriage, low fertility, and especially irregular cycles. Additionally, ultrasounds can be used to watch follicle growth. Fertility medications can be given to ensure ovulation as well as follicle growth. IUI continued. You will need medical clearance. So your provider at the clinic that you go to will probably ask you to meet with your primary care provider or your OBGYN, and possibly even a specialist. If you see an endocrinologist or a psychiatrist, and they'll want you to get clearance. They will most likely ask you to do these labs. These are HIV, Hep B, Hep C, syphilis, gonorrhea, chlamydia. That's what we talked about earlier for the preconception labs. Fertility assessment as needed. They may request a copy of your normal Pap, normal thyroid. They may ask you to check for anemia and any vitamin deficiencies. That's also something you can talk to your primary care, your OBGYN about. Okay, Fairfax will ship sperm vials directly to your clinic. The lab will prep the vial for you. Optional includes ovulation predictor kits. Your doctor may just want to do ultrasounds to watch follicle growth. They may also want you to do your ovulation predictor kits, and they may use fertility medications. Depends on what is best for you. The IUI process. So the speculum and the catheter, and I pointed this out on that diagram a second ago. This is your speculum. We know these are used to get into the vaginal canal. We use them for Pap smears, right? And an IUI for most people feels something like a Pap smear. It's usually pretty quick. Afterwards, you'll relax with a tilted pelvis for about 15 minutes. Oh, and I have our syringe or needleless syringe attached to the straw. So you can see the straw is pretty flimsy. And it just goes straight into the cervix. IUI cost. You'll pay for the sperm vial, the OPKs if that's what your provider wants you to use. You'll actually pay for the procedure itself. And you may, costs may include ultrasounds, medications, and various assessments. IUI success rates. So there's about a 15–20% success rate. In order to increase your rates, you may want to do ultrasounds or medications. Things that can decrease your fertility are age and comorbidities. Age, here we have a chart that explains that starting around the age of 30, your fertility slowly decreases. When you hit 40, it can decrease rather rapidly, which is why we recommend testing your fertility around age 35. Assisted reproductive techniques. So in vitro fertilization involves egg retrieval, fertilization of those eggs, and then they'll insert that into the patient trying to get pregnant. Reciprocal in vitro fertilization, egg retrieval from both partners and fertilization of eggs, embryo transfer into the non-egg contributing partner. I really like that option. I think it's really neat. It's a way to have a baby that is your partner's, but is grown in your body. I think that's pretty neat. Intracytoplasmic sperm injection. There's a lot of options for you. Let me get our next presenter.
Okay, can you hear me now?
I can hear you.
Hi. Okay, cool. Hello, everyone. Oh, thank you for having me on here to share my story. You know, all of this information, it was probably a lot. I've been through it. It was a lot to, to hear. I think it can be very overwhelming, and stressful, but worth everything. So, okay, I have a few pictures of our family. We are a Fairfax family. So if you want to hit there you go. So my wife and I did reciprocal IVF. So what Kate was just talking about, we used my wife's eggs and I carried. So we went to Fairfax in the fall of 2015. I loved the fact that I could see adult pictures of the donors. At the time, at least, other cryobanks didn't have that. And we found that there were a lot of like really cute babies that turned out to look like serial killers, like just gonna be honest. A lot of my friends and I joke about that. And they just had so much information and we fell in love with our donor and ended up buying 8 vials. We were a little nervous about it taking a while and initially had both planned on doing IUI. So if you want to go to the next slide, I'll walk you through our story, our fertility story, and then I'm going to talk a little bit about the legal stuff behind it. Okay, so we have 2 kids now. I have a son who is 4.5 almost and a daughter who is 1, so we had a COVID baby. Our original plan was to do IUI. My wife was going to carry first and then I was going to carry and we were going to use the same donor sperm. But my wife had really bad anxiety and going off her anxiety meds was not a good thing. So we switched gears and said, hey, why don't I carry your egg? And, because for her, she didn't want to give up pregnancy and having a genetic child. So I thought it was just so cool. And I still think that it is really just the most magical experience. As Kate had just said that, like, I got to carry part of her and I still felt so much like my children couldn't be any more my kids, even though genetically I'm not related to them. Although there is something called epigenetics, which I think is very cool, but I'm not going to get into that. Anyway, so we ended up doing egg retrieval and our son was our first fresh transfer. We were very fortunate. Unfortunately, going for baby number 2, we ended up having some failed attempts, had to go through another egg retrieval. My wife needed a hysterectomy, then 3 failed IUIs, a sperm shipment issue, which was not Fairfax's fault, it was mine. I was on the phone with Fairfax and my clinic back and forth. I can't even tell you, I literally have videos of me from that day because my clinic only accepted shipments, I think until like a Thursday, and I called on a Thursday to have it shipped because we were doing something on that Monday, and they were incredible. Like went above and beyond. The office was like closing and whoever it was that I spoke to called my clinic, they called the shipping plate, like it was just, they went above and beyond and we got the sperm in time. Thank God. So obviously to me, like Fairfax holds the most special place in my heart. We went through another egg retrieval with my wife because even after the hysterectomy, they kept her ovaries. And then my daughter was our first fresh transfer. So the embryo at the top left is my daughter, and then the one at the bottom is my son. And this was just kind of some of our journey. So those are not all the needles, but actually a bunch of the needles for my daughter. Going through IVF is a lot. It's a lot on your body. It's a lot financially and emotionally, but worth it. It's just absolutely incredible. So as a same-sex cis couple, we just assumed that, hey, we are both, part of this process. We're both part of, growing our children. We bought the sperm together. We had to sign the forms at the clinic together. We're both going to go on the birth certificate. We're good to go. So you can go to the next slide. Turns out that's not the case. And there are a couple different steps when it comes to legal when you're using donor. So we're going to talk about donor sperm here, obviously, since we're just talking about donor sperm. So why is it essential to hire a lawyer? So there's 2 different types of donors. We have a known donor. So if you're going to use a friend or someone that you know, you need an attorney immediately before you even go to the clinic. You want to just make sure that they are terminating their parental rights so that once you're pregnant, There's no question at all, no issue. He cannot come and say like, hey, I want to be a dad in this family. You want to make sure that the attorney specializes in family formation or assisted reproductive technology. On my business website, which I'll share, I have a list of attorneys in almost every state that do specialize in this. When you're going with an unknown donor, so if you're going through a cryobank, they typically do waive their rights up front. You know, with the cryobank, they have no parental rights at all. So you don't need anything in terms of legal up front, but down the line, once you have that child, you can do a couple of things. So you can get a pre-birth order before your child is born that says that both you and your partner are the legal parents of your child. Not every state allows that. So my wife and I, we went through something called second parent adoption. I think that's on the next slide. Some states it's called step parent adoption. So there was some little extra steps that we had to take to make sure that we were legally protected, God forbid something were to go wrong. Okay, so there the next slide. Sorry guys. Okay, so second parent or step parent adoption, it's called something different in each state. So what I said is that both parents get to go on the birth certificate when a child is born, but both of you are not actually deemed equal parents in the eyes of the law. And it sounds insane. A birth certificate is an administrative document governed by the state. Vital Records issues it. It's nothing more than an identification piece for your child. It's not a legal document. So you actually do have to go through a process with an attorney to ensure that both parents are actually viewed as parents. So in our case, my wife, who is the genetic parent, had to adopt her own genetic kids because the gestational parent, the one who gives birth, is the one that is considered the legal parent. So it's really crazy. And it's actually the same in surrogacy, where the gestational carrier has to waive parental rights. They just view biology that way as they're like, oh, if a baby is coming out of you, it must be yours. We know that's not really the case, but that's why it's essential to work with a lawyer. So where is this going to be an issue? So it's not required. If you live in a liberal state and you don't plan on leaving that state or visiting any other crazy states or countries, then you might be okay. But the issues arise with divorce and custody. And I know that everything is probably great and beautiful and happy now. It does not always stay that way. And in terms of death, so God forbid one of you were to die, who gets custody of your child? Who is going to be named the guardian of your child? And will your children be able to inherit from you? You just want to make sure that you are setting up your partner and your children for the utmost protection. Yes, you can have a will, and I highly, highly suggest that immediately you have a will who's going to name who's the guardian of your children. But the last thing anyone wants to have to do is go to a court after they lose a loved one to get an immediate, guardianship judgment. So that's why it's really important to just have this stuff done up front. So I started an organization called Connecting Rainbows, which provides free legal and fertility resources to the LGBTQ plus community to help start, grow, and protect your family. So I have this database of attorneys who do specialize in assisted reproductive technology, surrogacy, family building, all that good stuff. I think we have 42 states now. We have some Canada and Australia attorneys there. And then we have fertility resources. So there's blogs and vlogs and all of that. Fairfax is on there, offered a beautiful search code to look at the donor database. It's just something that, again, it seems really offensive, but it's important. Your family means everything, and you just want to make sure that you're protected. So going that extra step and doing the second parent adoption is something that I really do highly suggest that people look into, and call a local lawyer. A lot of them will have free consults. You can kind of walk through the process that you're intending to do. Some states, actually, you really shouldn't use a known donor. So it's good to go kind of, Oklahoma is the one that I do know. So it's good to kind of go into that up front, just knowing your options, knowing what you need to know, making sure that you and your partner are protected. So yeah, that's what I got for you guys. please, if you have any questions, I'm so happy to answer.
Jenna, thank you so much. That was really wonderful and great advice. Your website is, as you said, so many incredible resources. So hopefully people will visit and get the information they need. I'm going to invite Doreen and Kate to join us. And Jen, if you could keep your camera on, we're going to do the, there we go, there's everyone. So first, before we get into the Q&A, I do want to just let everybody know, for attending the webinar today, we are offering the LGBTQ webinar 2021 access code, which will give you unlimited access, the full package, the 149 package, valid now through the end of the month, which is really amazing savings. So please do take advantage of that. And Morgan, who is our marketing manager, is going to pepper us with questions now.
Hi, everyone. Yeah, we have a few coming in, so just make sure that you submit them to the webinar question panel, little sidebar, and we can go through those. So a few coming in right now. One is, how is Fairfax dealing with the current shortage of donor sperm?
I'll take it. So we don't have a shortage ourselves right now. I will say that the donor pool is a little lower now than it has been because there is great demand. And our current donor search only shows you donors that have available inventory, which we hope is less frustrating than you finding a donor and then finding out they don't have inventory. So we have really ramped up our recruiting efforts. Right when the pandemic started last March, we had to slow things down, as most people did. As you can imagine, we had to, put all those safeties and everything into place before we could have donors coming in. But we really have ramped up our recruitment and our production efforts to be able to get more guys in the program. And keep in mind that screening process is about 4 to 6 weeks, but then every dose that's produced has to remain in quarantine for 6 months per FDA regulations. So a guy that starts today is not going to be available to you all for 6 to 7 months. So all of the efforts that we put into place starting last fall all the way through the spring, those guys aren't going to be available until the fall or spring of next year. So we're really working hard to build up that donor pool for you all.
Can I ask a quick follow-up on that?
Yeah, absolutely.
I think my people would probably be very interested. What is the 6-month waiting period for?
So the FDA regulates gamete providers, and when they started, they first issued the regulations in 2005. It had to do with HIV testing. So the technology that existed at that time was not as sensitive as what's available now. So we test before and after a specimen is produced to ensure that somebody wasn't positive for an infectious disease, but it was just not detectable yet. Does that make sense? And then I will be honest with you, we could shorten that because technology is leaps and bounds better than it was. And there are, rapid detection kits that are, better now than they were before, but the FDA just hasn't changed their regulatory language. So yeah, so that's why we have to wait the 6 months.
Great. Okay, Kate, is DHEA okay, or should it be DEA? Is that for you?
Yes. Is the question about DHA? It's an added ingredient in prenatal vitamins.
Maybe it's a typo, but it does say DHEA. Okay. If that person wants to write in and clarify for not understanding your question.
Yeah, so DHA is an added ingredient in prenatal vitamins. I believe it's an amino acid, and it helps protect the brain and the spinal cord as the fetus is developing. If you look for DHA, now that you know about it, you're going to see it everywhere. If you have a bottle at home and it doesn't say DHA on the cover, just look at the back of it. It probably has DHA in it. I think a lot of these companies are catching on now that it's a very important ingredient. And then I wanted to say we recommend starting prenatals at least 3 months before trying to conceive. That will help get your iron, your folic acid, those levels up to a pregnancy level. It's because it takes some time.
Great. If you've already purchased an IUI vial, is it possible to split that into 2 IVF vials?
So we get questions about this a lot. We never recommend multiple thaws. The vial is meant to be thawed once and used. And the reason I say that is that, as you can imagine, freezing and thawing is not easy on the cells. So when we freeze the sample, we're adding a freeze media with a cryoprotectant that helps them to survive, but it's only meant for one freeze-thaw cycle. So if you use the IUI vial for IVF, there are some clinics, and I don't want to go into too much about this because we don't facilitate this, but there are some clinics that will scrape out from the frozen sample. So instead of thawing the whole vial, they'll just sort of, if you've ever worked in a lab, you do this for bacteria all the time, but it's a little different with sperm. You just sort of scrape the frozen sample to break some off, and then you would thaw that and use that for the IVF. Again, we don't recommend thawing and separating out the sample, but some clinics and embryologists will do the scrape. I do, Morgan, before you ask the next question, I do want to mention one thing. So Kate mentioned that for home insemination, Fairfax can ship vials to your home. Doreen, can you talk a little bit about that and some of the limitations with that?
Sure. So we require consent forms regardless of where you reside to ship to a home address. Depending on where exactly we're shipping to, it's either going to be a form that's filled out by your licensed medical professional or one that you can authorize for shipment to your home address. But we do require that to be on file prior to placing an order for shipment to a home address. And I did also want to mention that the syringe and instructions, please ask for that when you're making your order. We're going to try to ask you to, the client services, to make sure that you're getting what you want. But just to make sure that you get it, definitely ask us.
I would also recommend asking CS to confirm that we can ship to your state. There are some states, as Jenna alluded to, the parentage laws really vary state to state in the United States. And so I would recommend that if you want to do a home insemination, you confirm that with CS first. Our in-house counsel has worked really hard to identify the states where it might be problematic if you do a home insemination. So I wouldn't just assume that you can do that. You want to make sure that you can before ordering and shipping. Sorry, Morgan, I just wanted to jump in with that.
Great. How does Fairfax determine which donors will provide IUI or ICI specimens?
So we don't determine that. The quality of the fresh sample determines that. So we try to provide as many IUI samples as we can because that's what is most desired by our recipients. That's the most requested. It takes a higher count and motility in the fresh sample for us to create ICI vials than it does for IUI. So I'm sorry, scratch that, reverse it. The IUI vials, because as you can imagine, when you're washing out the seminal fluid, we do lose some of the sperm. So you want to start with that higher count and motility up front. Whereas for the ICI, we're manipulating the sample less, so we're just adding that freeze media and separating it into the cryo vials for you. So it's all really determined. We have different sort of algorithms that determine based on fresh count and motility and estimated post-thaw survival.
Great. Doreen, we have someone from Canada. Can you explain how the process is different for our Canadian clients?
Sure. So my understanding is that Canada has much stricter regulations about what can be imported specifically for donor semen. So we're not able to ship directly to Canada. Our clients in Canada can only purchase through the distributors. We have Can-Am Cryo, Repromed, and I think there's Canada Cryobank, which is brand new. So we do have 3 distributors that you're able to purchase our donor semen from. And there are specifically Canadian compliant donors as well as Canadian compliant vials. So you're first going to want to find out which distributor you're going to be working with to see what's available directly for you.
Great. Okay, here's a question, 2 questions that are kind of related. how many children can be conceived from the same donor, and then how does our pregnancy pledge work, or excuse me, the pregnancy reporting work?
Okay, so let me start with the families, and then Doreen will have you talk about the pregnancy and birth reporting. So the family limits that we have are all based on recipients reporting the pregnancies and births to us. So once Fairfax, in the United States, once Fairfax receives a report of 25 individual families, that can mean multiple children in one family, of 25 families, we won't distribute to new recipients anymore. If you already have a child, then you would be able to purchase for full siblings. This does, as I said, rely on reporting from you all. The international limits are varied. So in the UK, for example, it's a limit of 10. We tend to have a general international distribution limit of 15 additional families. But I do want to say that's with a caveat of saying we're following the regulations in the country and or state where it's distributed. So for example, Australia, each of those states may have different requirements. Some have a limit of 5 families, some have a limit of 10 families. And places that have implemented restrictions on the number of families have done that through an analysis of the population size. So the American Society of Reproductive Medicine recommends 25 families per population of 800,000. But if you think about the population in the United States, that's a huge number. So we actually made the decision over a decade ago to limit to 25 families in the United States. So again, once we have 25 families reported, we won't distribute to new recipients. And in order to report that, Doreen.
So we have a variety of ways for you to report. We have a really great portal on our website where you can report a pregnancy or birth. You do need to know your invoice number for that. You may not always know that number directly. So you can also call us to either ask for that order number or to report over the phone. You can also email, and we're able to find your account through information that you provide to help you report. The information that we get from this, though, is only as good as what we have. And I always like to tell clients, we can't chase you down and force you to report this. And our expectation is once you have a baby, you're going to be busy. I talk to people who report 2-year-olds, 3-year-olds, 5-year-olds, and they just haven't had time until they call us and say, oh no, I haven't gotten a chance to do that yet. So those are our favorite phone calls. Honestly, you make anybody's day when you tell us that you have a pregnancy or a birth with our donors.
I never reported Josie, but I'm already in the system, so.
Yeah, I already checked you out. I do just want to say it's not just important to report births and pregnancies and births to us, it's important to report anything to us that's important. Any medical issue that may arise, stay in touch with us, talk to us about that. If your child has a diagnosis of something, it's important for the cryobank to be aware of that, because if that's the case, if there's an increased risk to other offspring, we want to be able to notify the other recipients. We want to be able to update that summary profile with that information. So I would just sort of look at this as we're in a relationship, we're providing the sperm for you and you're having a child, and we want to know how you're doing. We want to know how they're doing. So just stay in touch, and we are actually in the process of setting up additional easy ways. As Doreen mentioned, we have an online portal for the pregnancy reporting. We're in the process of setting up additional reporting online that'll make it even easier, where you can report something to us and request a callback from either a genetic counselor or someone like a director level like myself, so that we can talk through things. So that'll make things even easier. We're really committed to transparency and sharing of information. So getting that information from you is really important to us.
Doreen, can you talk about the pregnancy pledge a little bit?
Yeah. Sure. So we have a pregnancy pledge where we, the cryobank, pledge to provide you with a free vial after 4 failed IUI inseminations. You do have to be within the parameters of the program, which I believe the cutoff, there's an age cutoff. And we do send a form to verify this information to your clinic or a licensed medical professional to verify what donor and when insemination was performed, to match it against your account. But once we have all the information, and if you qualify, we are able to provide you a free vial for future use to hopefully achieve a pregnancy.
I have a question for Jenna. Is there a way to estimate the cost if you don't need anything upfront, that you want to do the second parent adoption process or the step parent adoption process? Is there a cost estimate for that process?
Depends on the state, for sure.
Right.
I would say the average is about $3,000
Okay.
per kid.
Okay.
Ours was a little cheaper, but ours was 2, but I know some states are like 4. So I'd say between 2 and 4,000, but some will offer you a payment plan. So you can always ask.
Yeah, I think it's just good for people to have like a frame of reference for all of the different costs.
It's a lot.
Can I just say that Fairfax Cryobank provides adoption letters to help with that for our clients, that we get requests about that frequently, but it's a letter from the cryobank stating that you did purchase a donor from us who has waived their parental rights. And that usually is a tool that the attorneys will use for the second parent or step parent adoptions. So if you're in that process, that's a free letter from Fairfax Cryobank. That's not something we charge for. So if that's something you need, call us and ask us for that.
Yeah.
Okay, someone wants to know, when I'm pregnant, should I continue taking my prenatal vitamins? Does she hear me?
No, I'm sorry, I didn't hear that.
When I'm pregnant, should I continue taking my prenatal vitamins?
Yes, yes, you keep taking them through pregnancy. If your doctor wants to add any extra supplements onto that, they'll let you know. But yeah, you just keep taking them through your pregnancy. They can be sort of hard to take in the beginning, the first trimester, where the nausea happens. I always recommend for that period of time, go get yourself some gummies. They'll be like little teddy bears. You can eat the head for breakfast and the bottom for dinner. So that way it won't upset your stomach, but definitely take it with food and continue taking it through pregnancy. And then you'll likely take them while you're breastfeeding as well, if that's something you plan to do. But talk to your doctor about that. Good question.
Here's one. We have our embryos stored at another facility. Do you offer embryo storage?
We do. We will store any reproductive tissue you have, and we have locations in 6 different cities. We're in Fairfax, Virginia, Philadelphia. We are in Houston and Austin, Texas, Pasadena, California, and in Roseville, Minnesota. So you can store at any of our facilities. Transferring is fairly straightforward. It's just paperwork for us, storage paperwork for us, and then you will have to do whatever your current clinic requires in terms of documentation. And then the samples will be shipped to whichever of our locations you choose. If you're local to one of our locations, you can do pickups. And this applies also to the donor sperm, but you can, like the day that you're gonna do a transfer, you can always pick up the tank instead of paying for it to ship from us to the clinic. If you're local to one of our facilities and you're doing inseminations, you can ship your vials to one of our locations and do pickups as well, and that will save you on the shipping if you're doing multiple shipments. The other added benefit of doing that is that if you store with us and end up not needing all of your vials, you can return them for 50% refund, and you know, it still counts if it's at one of our 6 locations. It doesn't just have to be at our Fairfax location. But if it leaves our facility, the vials are no longer eligible for return. Got to get that in, right, Doreen?
Yes, exactly.
Yeah, I've had a couple questions about the vial buyback program, so I'm glad you brought that up. When ordering, can you control when you want it to arrive?
You can, to a degree. I mean, to a degree. We offer 2 kinds of shipping options for shipping donor semen. We have 2 business day shipping, which is our standard, and we have overnight shipping, which is our upgraded option. Some clinics require overnight shipping since that arrives the next business day before 12:30. Other clinics don't have any parameters for that. But our shipments do only ship and arrive Monday through Friday. So if you have an insemination on the weekend, you're going to want to have that arrive before that, like want to have it arrive on a Friday. if your insemination's on a Saturday. But so keeping that in mind and knowing when you're going to have the insemination, or if you need to have it stored at Fairfax for a month or so before you ship it out, you'll also need to consider whether or not your clinic offers storage and if their storage fees are more or less than what Fairfax offers, to make the best choice for you.
Okay. And then how many vials should they be ordering?
That depends on your clinic usually and what insemination procedure is going to be done and what they require. I always recommend that you just have that conversation with your clinic. Some people want to order more than what's required for their insemination so that they have them in storage. Like Jenna said, she ordered 8. And people frequently order a larger amount and have them sent out one by one per month, per cycle, to see what they need.
How long does it take for the consent to go through before releasing the order?
Is this referring to the home consent?
I'm not sure.
Okay. Well, if it is, it
Yes,
depends
yes.
on if your if your clinic signs off on that, or licensed medical professional. Once client services receives the form, we're going to process that as soon as we can. But sometimes that's when you have to micromanage your licensed medical professional to make sure that they receive the form, they sign the form, they send it back, they have your correct address, they have your correct name. We want to make sure we have all that information correct before we can process it. The processing of the form usually takes under 10 minutes once we receive that, and then we're able to place your order for shipping to a home address.
Oh. Michelle, how often do you restock donor semen, and how does it work for the imported Canadian vial?
Yeah, so this is a common question. So as I said, our donors are in the program a minimum of 6 months for about weekly donations. Some of them will stay longer, especially if we are getting fewer vials per sample. They'll be in the program a little bit longer. We're constantly trying to create new inventory and clear it. So as I said, we have that quarantine period, right? So we need the pre and post blood draw. So instead of waiting 6 months, we're basically doing blood draws on these guys every 90 days minimum. Sometimes we'll do optional blood draws to release additional inventory, especially if they are only releasing a few vials at a time. So we're constantly trying to replenish it, but every 30 to 90 days we're doing that. And it works the same for Canada availability. So for those of you in Canada, the regulations in Canada changed back in February of 2020. So basically all of our donors and donor inventory from February of 2020 forward is technically Canada eligible. Inventory donors prior to that had to have additional documentation and testing and everything. So it was a little bit more challenging to get inventory and donors into Canada. So you should be seeing that replenishment on a similar sort of timeline.
Great. All right, we have one last question here, and this one says, this question is for Jenna. Is your website a place where we can find out individual state parentage laws? Is it based on state of birth or residency? Or is this something we can be connected with someone through your website to determine?
Yes, so it's really you connecting with the attorney, and it's based on where you deliver your child. So if you are doing things kind of shortly after the child is born, some states, if it's been like a year or longer, it would be where you live, but it's typically where you give birth. But every state is so different that compiling all the different laws hasn't happened yet. And they're changing too.
Great, thank you.
Okay, so I guess that's it for the questions. I just want to say thank you to each of our panelists. Kate, thank you very much. All of that information was so helpful. And Doreen, thank you as always. Jenna, it's been a real pleasure getting to know you and having you present with us. And thank you so much for sharing your story. It was lovely.
Thank you for the sperm.
You're welcome. And thank you to all of our attendees. And if you are in the California area around LA or Pasadena, Kate is available. She works out of our Pasadena location. If you're interested in working with her for inseminations, you can just Google our Pacific Reproductive Services. You can see it's on Yelp, on Facebook, on, through Google. And she's fantastic. All of her reviews are fantastic. So if you're in the area, look for Kate.
We would love to see you. You're welcome to come.
Yes. So again, thank you to all of our attendees. Morgan, thank you as well. A copy of this will be emailed out to all of the registered recipients, and keep your eyes open for the announcement for our next webinar. Thanks everybody, and have a great rest of your day, and happy Pride.
Happy Pride. Thank you.